My name is Brad Henderson. I'm the president of the Pittsburgh Kids Foundation. I wanted to thank you for taking some time out of your busy day today to check out our conversation on community health. It's not going to be a long conversation, but I think it's going to be a very informative conversation for you. And I'm sitting here with Dr. Wislyn Avenard, one of my favorite people in the whole world. I've known Wislyn since he was a little guy. I think you were 8 years old when I first visited EBOC and met you there. And one of the things that I remember about Wislyn from first couple encounters was that God had gifted him with a very strong mind, and his teachers in his school backed that up. But I also noticed that Wislyn was a man of great heart, and I think you mixed together for a long time. Wislyn thought he wanted to be a pastor because of his heart for people. But as he got out and did some ministry, some evangelizing in some really remote places in Haiti, discovered the huge physical needs that people had and felt like God was calling him to do something about that. So fast forward, medical school, you are now the medical director at the CHIDA Hospital in Cap-Haïtien, Haiti, 15-bed facility with a full staff, and you see roughly 300 patients a day, and at the facility, usually right around 75, but the rest of them are through community health. Tell me a little bit about community health.
So community health is kind of program that we create, but because before we start CHIDA, we were able to meet the problem of the community while doing mobile clinic.
So the community health goes back even further than the hospital.
Sure.
Okay. All right.
Yeah. So we were able to meet all the problem that they have there, and then when we start, we think that's something we have to do definitely because of different reasons. So that's why we started community health program to address better the problem in the community.
Yeah, and I think some of our viewers are probably new to this idea of community health, but it's this idea of going to where the people are. Taking, you said 44 community health workers at CHIDA, and we hope someday more. And they've been trained in basic medical skills and knowledge, and they literally go out door to door and visit people. Why is that so important in Haiti?
It's so important because people, for different reasons, are not coming to hospital all the time.
What are some of those reasons? Why would I not come to a hospital?
One of the reasons is that it's what they trust in. It's voodoo.
Yeah.
And sometimes it's difficult for someone that like voodoo, that being voodoo, to accept that they get sick naturally.
So for a lot of Haitians, they think that voodoo caused their illness, and
almost everything.
That's the fix as well.
Yeah.
So it's that value of voodoo even over medicine.
Yeah.
Okay. So there's an educational.
So we need to go meet them and then explain them everything is not voodoo.
So is that the only thing that keeps people from
not
the hospital?
Only thing. Another reason is that very large family, a lot of kids, and not really able to support all of them, not very able to feed them. So the less money that they have, they keep it to feed the family. That's the first or the most important thing for them, feed themselves. So they won't spend money that they have to go to hospital. And that's...
So there's a big financial barrier of not even feeling like even if they got to the hospital, they wouldn't be able to afford it.
Sure.
Okay.
Sure. Another reason is the behavior of people that are working in hospital, like doctors, nurses. Sometimes the way that they receive or they talk to people, it's not good. And some people, they won't come for that. They won't come for different reasons.
So I know, our community health program, we have different programs. We've got a large malnutrition program because unfortunately, not only are there a lot of kids in our area that are severely malnourished, but a lot of adults too. I know a big part of community health is just kind of general medicine, going in and assessing what the medical needs are, right? And I know you've got a program for new and expectant mothers. Can you tell me a little bit about that one?
Yeah, so we have a prenatal care because the reason is that too much mortality while giving birth. So
So infant mortality,
Yeah.
big problem in
Big
Haiti,
problem.
big problem in your community.
Not only infant, but it's mother's mortality too, because
mothers as well.
Yeah. And then we had to address the problem because it was a very big problem in the community. So that's one of the reasons that we decided to create a prenatal program, not only to help them give birth, but to go to them, to help them to follow up, to help them understand how important it is to follow up, because it's good for the baby and it's good for the mother to know or the development how, and then so when they are ready to give birth, they can give it in the very best condition of.
So it's kind of being with them from the start and talk to them about nutrition. Some of these moms might be malnutrition, which obviously is a big problem, walking through the pregnancy process with them. But sometimes they get to the point of having done that and they still don't come to the hospital. Why is that? Why do most Haitian women not come to the hospital to give birth?
So it's not something that's in their culture. And another reason is that they trust the matron very, very, very much. And
okay, so what's the matron?
The matron are kind of women in the community. They said that they have been called to be able to help people giving birth.
Okay.
And people in Haiti, they trust them a lot. And they have a very big faith in voodoo too most of the time. That's why people trust them. And sometimes the matron realize that they are not able to do something for someone.
So
and
if it's a simple birth and things go well, that might be okay. But some of it's, I guess, would be identifying those moms who need to come to the hospital. And also, I would hope that the matrons in the community would understand that too, because these are grandmothers, these are friends, and to experience a mom dying in childbirth and a baby dying in childbirth is a traumatic thing that obviously nobody wants. Okay, you shared with me just a really amazing statistic. CHIDA's been open 3 years. The community health program for the new and expectant mothers has been going on 3 years. How has that impacted the infant mortality rate in the local community?
So we are able to, with the F community program, to decrease the amount of death, and it's very high, the work that we were able to do.
You shared with me, what was the actual percentage number?
It's about 71.
71% drop in mortality in the birthing process. That includes mothers and babies. That's a powerful thing, and just a great reason why we need to keep this community health program going and growing. And
definitely,
again, we didn't want to make this a long conversation, but as we wrap up, can you maybe share a personal story of somebody you've seen benefit from community life and have their physical health life changed by that?
I have to go far to find someone, and it's a very interesting story for me. Especially, there is a old man. So he was like
older gentleman.
And
how old?
About 60.
Okay.
And then
we're getting a
was playing drum for voodoo priesthood, and then for a long time.
Okay, so playing drums literally in the voodoo ceremony. So obviously had bought into that worldview and the medical piece that comes with it. All right, keep going.
So this man became very sick, and everybody thought that it was about voodoo. And he had to visit 9 voodoo priests to see if they could treat him.
So he went to 9 different voodoo priests.
But they could not. The last one sent him to hospital and said, we are not able to do nothing, so you need to go to hospital, or you need to wait until you die.
So at least we got to give that voodoo priest some credit of realizing it was too big for him to solve and actually sent him to the hospital.
Yeah, because there's nothing that they could do.
So did he show up at CHIDA?
No, they did not come to hospital, but we were on the field doing screening for hypertension. And then we were able to go to his home, and then his blood pressure was very high.
So even after he was told by the priest to go, he still didn't go?
No, he still didn't go to the hospital because, he did not trust hospital. So when we checked him, his blood pressure was about 211/141.
Wow.
And we said, wow, why a very high blood pressure? and then they did not trust us. We had to take it 4 times, and they trust, and then they allowed us to talk to them, and then accept us to check on them. And then a few days after that, I get back to them and bring meds for this man, and 3 different kind of hypertension med. And after 5 days, I went back to see them. The man that was on his bed for more than a month could sit in the yard on the chair, and then the swelling went out.
Wow.
Because he was taking meds. And then I went to Port-au-Prince for some reason, spent 2 months. When I get back, this man got accepted Jesus and then become a Christian. And just because what we were able to do with the screening, with the F community program, with the workers, we were able to convince them, not telling them to accept Jesus, but what we did convince them to understand that everything is not voodoo, and there is more than voodoo.
So you got, the healing of his physical health.
Yeah.
But just as importantly, maybe even more importantly, his spiritual health. And that's a great story, because I think it really sums up the vision that you have for people, for CHIDA, of meeting their physical needs, but not ignoring the needs of their heart as well. So, I want to say thank you for all that you're doing on behalf of people, and encouraging you to continue to do more. And my hope is that more of us will get educated on the needs in Haiti during this week, and be compelled to give and support some of the great programs in Haiti that the PKF has the privilege to be a part of. And one of my favorites is the community health program.
Sure. So it's something that we have definitely to do.
Thanks for being with us.
Thank you.